This short video will walk you through the basics of clinical documentation, especially or specifically, I'm going to discuss a progress note since it's a note that we write every day and probably the most liable for missing data and information and mistakes. I believe this is an important topic that you need to know very well for your daily work with patient encounters. So let's get into it. So why is it important to make sure that your documentation is accurate and professional? Well, for many reasons. It's a crucial part of patient care and safe patient care, and an important tool of documentation between providers and all the staff taking care of your patients. It's also an EPA or an trustable professional activity needed for residency advancement, meaning one of the goals of residency training is to train physicians on how to accurately document the service that they provided to their patients. And if you think about it, actually documentation is associated with all the other ACGME core competencies, including the patient care, like we talked about earlier, also professionalism, and of course accurate documentation is an integral part of our profession. It's part of the system-based learning, and many functionalities of our healthcare system relies on accurate documentation, and so on. Good documentation reassures the attending that the resident knows what is going on with the patient and able to document that accurately. Remember, your note is a legal document. You might need it months or years in the future, so you really want to make sure that your notes are actually a real reflection of the patient, of the care that you're providing to your patient. And finally, reimbursement is based on what you document. So you need to give yourself and the hospital a credit for the effort and for all the care that you provided to your patients, especially in complicated patients and difficult encounters where you spent more time probably than you spent with other patients. Please refer to the documents and examples that were presented and sent by Dr. Reddy, the Associate Program Director, at the beginning of the year and recently in a Zoom lecture for details about how an ideal HMB and progress note should look like. Let us know if you do not have these documents, and faculty or chief resident can send them to you. These are very, very important. Next, I'm just gonna discuss briefly the assessment and plan section of your progress note and how to make it better. And then I will give some examples and specifics of what the hospital is looking for in terms of physicians' accurate documentation in their progress note. So the first paragraph in the assessment and plan structure, I believe, should be a brief clinical vignette and summary of the presentation of the patient. So it should include the patient age, gender, pertinent past medical history, chief complaint, pertinent symptoms, and duration of these symptoms. Some residents like to build on this paragraph as more and more information and data are gained during the patient hospitalization so that they can use it later in the discharge summary. And that's fine as far as it has all the pertinent event and important hospital calls. And then next you start to list the problems, and the first problem should always be the most acute problem, the most serious problem, or the most recent problem. That's the first thing that you have to tackle. And I think it should include 4 components. That's how I like to think about it. The first one is what is the most likely etiology or underlying pathology of that presentation, meaning the most likely diagnosis. And we need that element of commitment. And if it's not really clear and all the options are kind of have similar probability, and that's fine. Sometimes we just don't know especially in the first few days. So you can document that the exact etiology is unclear or something like that. But most of the time, if you have enough data, and you should, by history exam and lab and imaging, you should be able to come up with a most likely diagnosis. and don't write versus because this versus that, because it doesn't really tell me exactly what's the most likely diagnosis in this situation. And then next is why do you think that this is what you mentioned above is the most likely diagnosis? So you need to give some supportive objectives from history, from exam, from lab or imaging, like really the pertinent finding that really support your most likely diagnosis. And then you can always mention some of the other possibilities. What are the other differential diagnoses that you should think about? It's always should be on the back of your mind. Just to make the reader know that you're thinking about this, and it'd be nice if you mention why they're not the most likely diagnosis. And then the fourth component is the course and progression of this particular problem. Is it getting better? Is it getting worse? What's the overall assessment? What's happening with this problem overall? It's really important that you can come up with a progress about that problem from all the data that you have. So these are the four components that you should keep in mind when you're writing the assessment. And it's kind of the same thing for the plan. I also like to think about it in four components. You're going to write the medications that you're going to use to tackle the problem, the investigations, and any consultations and what the recommendations are, and also the thing that you need to look for or to monitor the progress of the patients, and what are the complications that you're expecting, what are the things that anyone who's gonna come after you should look for in terms of specifically complications, specifically the most serious ones. So if you think about the assessment and plan in the 4 and 4, I think it might you might find it useful.